Namaste. How are you, Dr. G? Very
Yes, sir. Good evening. How are you, sir? Happy Teachers' Day.
thank you, and wish you the same.
Thank you.
How was the day?
Fine, went on well, good.
Okay, fine, very nice. So shall we start today's class? So I think on time
Good
all
evening,
have.
sir. Happy Teachers' Day.
Thank you. Namaste.
Namaste, sir.
Namaste. How? Okay, fine, thank you. So shall we start today's section now without wasting time? So as I have told, immediately after this section, I have given one more link by which you will be able to log in for the discussion hour. So whatever the question you want to ask, so you can ask at that time. So what you can do is that you can just see over the slides, understand the concepts. So after that, you will be able to discuss anything over the next section just after 40 minutes. Okay, so we will immediately start over to the program. So okay, so today we shall speak regarding the importance of Nadi diagnosis and treatment. So first of all, we should understand that Nadi means it's not simply feeling the pulse and understanding. I have been telling you that Nadi is much above that. See, Nadi, it comes only after you learn all the things. When if you are able to understand, keyhole of each and everything, then only you will be able to understand Nadi. So you should be knowing anatomy, physiology, pathological condition, and each and everything when you are knowing. And if you are able to make out the rhythm of the heart, what is regurgitation of heart, each and everything, then only we will be able to understand the Nadi proper. So just simply by learning Nadi, you will not do any job. So henceforth, Nadi which is very vast. So you should be knowing the knowledge of marmam, how the Ida, Pingala, Sushumna Nadi will travel over our body. So if it is blocked in anywhere, so what are the waves it is sending us? So all these sort of things we should be able to know, then only we'll be able to understand. So in the initial stage of beginning, for the beginners, start feeling the Nadi by like pulse reading, as I have given you in my YouTube video, how to see the Nadi. So please go through that, understand, please feel the Nadi. Unless until you feel it, you will not get it. It's something like that. If I take on class how to swim, so you do like that, do like this, no, you will not learn. You have to enter into the swimming pool and you have to practice, then only you will get it. So henceforth, please first of all feel the Nadi. Okay. So okay, coming to the point. So concept of Nadi, how it has been started. So it was evolved from good olden days to understand the person is dead or alive. So when the inquisitive human brain understood each Nadi differ from one to another, they understood that a family members have the same Nadi. So the concept of Duta Nadi has been developed. Okay, so Duta Nadi means you'll be able to understand what is Duta Nadi. See, if at all, for example, my wife is sick and I am going to a doctor telling that my wife is feeling some problem. So without the doctor asking what your wife is suffering from, by just feeling my Nadi, the doctor should be able to understand what my wife is suffering from. This is exactly means by Duta Nadi. So Duta means the bystander. That could be a husband, that could be a bystander. That could be anyone who is very loving, caring, who is very much attached to the patient. Getting the point? So in the same way, because it was very much essential in those days, like no, in the olden days, they did not had good transportation facilities, was not able to carry the person, those who are really bedridden. So henceforth, the person only used to come and tell this problem and take the medicine. So in order to understand what, even though there could be a difference of a language problem, also there could be a problem. So henceforth, to go beyond all the problems, by just feeling the nadi, the physician were able to understand what is the exact problem, what actually I have to give. So nowadays, why I am telling the relevance of the nadi pariksha means, so you leave out of the nadi, duta nadi, you just leave it. But at least if you are able to feel the nadi, and if you're able to understand what is the pathophysiological process it is taking place in him or her, it will lead you in a greatest mystical diagnosis will be accurate and super. So even many cases we are knowing that. So if you are going for a CT, MRI, blood test, each and every test, so many a times we fail to recognize why this problem has occurred. Many a times we should understand one thing, reading the causative factors for many disease. Rheumatoid arthritis etiology is unknown. Rheumatoid arthritis, cancer, so what not. Each and everything we say that etiology is unknown. We tell that GB syndrome etiology is unknown. That could be possibly like a virus has been the stimulator of it. So many things we do not know exactly how all the disease starts. So henceforth, it's very important that where the progression of disease has occurred, in which level the disease has occurred. We have got three layers, one below the one, inside the another. This is Annamaya Kosha, what you're seeing. And inside that Manomaya Kosha, then inside it Atmamaya Kosha. So henceforth that we should be able to understand whatever it is coming, it should come within. Anything from outside cannot spoil us. Make the point that anything from outside, just by seeing, just by influence of other people, so we cannot be spoiled, or manas cannot be disturbed. So whenever we have an affinity in our mind towards something, bad habits, that could be some criminal thinking, then only the same sort of criminal people get attached together and they work together to do some irritation to the society. So henceforth, attracting the like-minded people, it also has the ability, the quality goes to the manas and atma. Henceforth, to develop a good thought within us, it's a mind thing that we have to struggle and establish. So henceforth, what we have to do is that, so when one is ill in the family, that vibration is passed to all the family members who take care of them, and those who love them, they consider their pain as self pain, so that only after few days they have the similar problems, if not corrected in the psychic level. So one patient had come to me, sir, my brother has died because of cancer, and after his death, what happened, I have been getting the same symptoms of my brother itself, sir. But I have gone through this scan, X-ray and everything, but there was no cancer. But whatever he was experiencing, I am experiencing. What to do, sir? I feel that I am having cancer, but I go to the doctor. No, you are simply psychological. You take that tablet, antipsychotic tablet. So now you have to understand one thing. If you are not influencing the other will influence you. So it is up to your decision whether you are going to influence or get influenced. So many a times you will be able to see that some few wears the gemstones, etc. And if you allow the gemstone to act over you, then definitely it will act. If not, otherwise, we will influence that. So it means that the energy can pass from higher concentration to lower concentration. You have to decide whether you are in a higher concentration or lower concentration. So what happens? So basically, if we are having a correct manas, guided by a proper ideology, nothing can influence us. That is the first and foremost thing we have to understand. So understanding the through the waves. If you are thinking negatively or positively or suicidal thoughts, so suicidal thought, all will have a particular wavelength, and it will pass into the brain, from there to the neurons, and that particular waves are passes the information to the particular area of the brain, and from there it moves on to the body organs and gives command accordingly. So definitely, if you have to stop thinking negative, what we have to do? So if you are thinking that I should not think about that, your mind thinks that about the same thing. Now let us try something for 10 seconds. You should not think about a plant. Is it possible? Every time you say should not think, you think the same. So usually what happened? So few songs I do not like actually. I tell what is that? No, I don't like that song. But every time it pokes me, and with irritation I sing without my knowledge. I get so that's why mind will act in that way, because whenever you tell I don't want, it requires. So what to do for that? So how to generate the correct thought within the patient's mind as well as our mind? Because in Nadi itself, it's not that I will go and see, it will help only for the patient. So it will help you also. So many a times you will be able to see few doctors after 33 years. They serve the community. Quite recently, maybe in Bangalore, one of like 33 years old young gynecologist lady, we have heard in the newspaper and everything. So she after finishing all her duty, even though she has, her hospital has got all the investigation facility, but no one could have saved her life, because there was no premonitory symptoms also. See, because see, we are not aware what is really happening in our body. So Nadi, it's a way, if you are able to learn, and if you are not treating anyone, at least you should be able to understand what is happening. So how is my health now? So what could be done? So all these things, if you are able to understand the Nadi, it's a self-understanding. So, and self-understanding is more popular or more very nice than learning outside, because antarmukhi, we are given a eyes outside so that we can see the world. So actually 2 eyes has to be given inside so that we can see ourselves. That seeing ourselves, that is antarmukham, is related to the Nadi also, where you will be able to understand what are the things happening in your body. So for example, Bhishma is an Ichamarani. So we are also having the Ichamarani property. Whenever we say what this life, very miserable life. So what we are thinking, let me die. That is very disturbing for me. If the thought comes within us, what will happen? Without our permission, we have given a permission, definitely, and the immediately later on moment, when everything will become okay, we tell, now okay, I am happy. But whatever you have told at the time of your misery, that will enter into your mind, and that it starts acting. So henceforth, without your knowledge, you will become sick. So henceforth, what you have to do is that, so you have to give Sattvava Jaya Chikitse to yourself. That is how I have been telling to my students that practice that Sattvava Jaya Chikitsa, or a Set Chakra meditation, which I have given in my YouTube. You can just go through. It is in 2 languages, English as well as in Kannada. Okay, you just go through that and you practice it, so that you at least lift up your mind, so that nothing will affect you. So I have told you that manas is one of the greatest factor which will lead us to a disease. So only it has been told that ragadi rogan satata anushaktan ashesha kaya prasurutanu sheshan outsukya moha aratitan danjadana yu apura vaidyaha namostu tasmai. It means that, see, because of all the miseries, kama, krodha, mada, matsarya, all those things only, we are becoming sick day by day. If you are to remove that thing, means we have to change our mindset, and only the God who is able to relieve all these symptoms. I am saluting you. It is been told like that. Then only Charaka Shushruta Bhagvat have been explaining related to the medicines. So it means that how much relevant is that manas is. Getting the point. So coming to the next slide. So understanding the waves means understanding the manas. So if you are feeling the nadi, means you are feeling the manas, getting the point. So you are able to read the manas of yourself and your patient. And if you are able to understand, Are Baba, you are having a suicidal tendency, what happened to you? Means suddenly the patient will burst off with tears. Sir, how you understood? And you can tell that this is the thing which is happening in you. And if that process, if everyone learns, means what will happen? Most of the times we keep on with them antipsychotic drugs, but still we are not able to reduce the suicidal suicides. So definitely, if you're told, if it is possible to give Sattva Vajaya Chikitsa to them, I assure that many people will get survived without any medicine, because manas itself is a famous and precious medicine all over all the medicine in the world. Okay, so now coming to the point. So now we understood that manas is the culprit for disease and health. Okay, without correcting the negative thinking in the patient, you will not be able to cure disease. So most of the time we are controlling disease by the means of medicine, by its chemical property, but not finding that why this disease came to me, where is the negative thought running when the software is correct. Then there is no use of hardware. Henceforth, try to get corrected of manas, which is the source of disease and harmony. So we are just giving symptomatically all the Pati doctors, Ayurveda, Allopathy, Unani, Siddha, all the Pati, because they, even though we tell that we are treating the manas indirectly, but you can give some suggestion, right? Where if you are able to talk with the patient for few minutes, you can give few suggestions. You can give Sattva Vajaya Chikitsa, which is the greatest form of the medicine. Without that, why you have to take an indirect route? If you are able to eat in this way, why you have to eat like this? That is my question. So when suggestions are very easy, and when if you are able to guide the patient in that way, that is very more essential part of the treatment, I suppose. So only there is Astavida Pariksha. In the Ayurveda, it is being told that. So in all the ways you have to see, understand, feel the pulse. So feeling the pulse, that is among the Astavida Pariksha, that is among the 8 Parikshas, Nadi Pariksha is only the one way. So including to the Nadi Pariksha, there is something called as Sattva Vajaya Chikitsa, where if you are not able to treat the manas, definitely we will be a failure, because only we will be able to relieve the symptoms and not the disease. What is the disease? Diseased condition is the manas. Manas is exhibiting in a different forms. We can call it as IBS, sugar, BP. And I can ask you one question. So each and every patient is taking sugar medicine, BP medicine. Definitely they are keep on taking the medicine. If they leave, and it will come as previous itself. And in a condition where one patient had come to me one month back, he was suffering with hypertension and also diabetes since 10 years. He was keep on drugging himself with varieties of doctors. He was taking all the four types of hypertensive drugs, 2 types of sugar medicines, diabetes mellitus medicine, insulin. So what happened? He's around about 50 years. He was his abdomen was started bloating. It's just like a condition of ascites. Just before to the ascites, what is the condition? So he's not able to walk 10 steps. He was to get nauseating feeling, but still after taking all these tablets, medicines also, sugar and BP was not at all under control. It was going for a renal failure case. So now what I have done is that, so I told them, you have enough drugged your body with 10 years with lot of medicines. Now no chance of your body accepting these many drugs. Please, will you try to leave it? I asked him. Yes, sir, I'm ready. Okay, you leave all the medicines, whatever I tell you, just you take and be happy. Okay, then what I have done is that I have corrected his nervous system by drone, and whatever the block it was there has been relieved by Marma Chikitsa, and few problems by acupuncture. When the deep-seated energy, vasi or energy, when it has been deep-seated, so if we are not able to relieve with external marmum. So we go with the marmum acupuncture points to stimulate it to relieve that blocked energy. So only in Ayurveda it is been told that Kha Vaigunya Vyadihi Upajayate. Wherever there is a block, there is a disease. That could be in a mental level or in a physical level. So we have to understand whether it is a physical or mental. So based on that, we have to treat. So after that, I have sent him. So after a day, he just called me, Dr. G, now I can work from morning to evening. What a surprise. What I have done, nothing. I have set his spine correct. I have cleared his block, finished. Immediately he felt a sense of relaxation. Moreover, that I have given Satyabhabajaya Chikitsa to overcome all the tragedies. Okay, so now what happened? He is still in contact. He is not taking any sorts of medicine. He is bindas, aram se, happy, no problem at all. So he will be able to walk from morning till evening. So sugar and BP has come down to the normal. So now what do you will tell that? Still, since 10 years, he has been drugging without any use. Expect he was getting one or the disease another. So he was shortly for a renal dialysis, he was going to future patient of dialysis. So hence I'm telling you, if you are able to understand, if you are able to correct the manas, so it will becomes a very easy job, because body has that much potentiality to cure any juncture of time. So I ask you only this much to understand the power of manas. You give assurance to the patient. So henceforth, the patient will sustain to live. So once what happened, I tell each and every case that once what happened, one patient came 10 years back. He was being told that 75 years old young man, he came to me and told that doctor, his son had taken to me. So only 2 months doctor has given. It's all the heart functions has been disabled. So what to do? So I have given assurance, after which he was able to live for 10 years. Only last year, November, he was able to, he died. So he is near to my clinic, Balahanur itself. So it means to say that, so giving assurance itself, it it promotes us in a great way. So henceforth, do not lose don't lose by seeing the medical report. Once what happened, I was just I had fall from a top of around 30 feet, where my ligament tear was there, my knee joint ligament. So when I have seen taken MRI and all, so doctor has surprisingly asking me, where is the patient? Sir, tell, I am only the patient. What has happened to you? It's not whatever it is being told in the report. It is not really, because if it is really, it was the same report, you would have not been able to walk anymore. So you are walking very nicely. So what is the problem? Sir, little bit pain. Okay. That is not a problem. So in the same way, just I wanted to tell you is that don't rely on the reports. Reports never tell you the truth, because they will really misguide you. So one of the patient came 1 week back telling that, sir, I am having thyroid. How actually it was started since 6 years. When I have tested for thyroid, it was normal, but anti-thyroid antigen was very much high, sir, 136 or 140. So doctor has started the medicine. Okay, after which what happened? That antigen did not reduce at all, and the normal all the TSH T3 values are also normal. Okay, no problem at all. What happened after 6 years? Now recently, now she has all the problems, whatever she was suffering was really there, not went, but it exaggerated very much high. Palpitation, everything, sweating, everything is high. Now when the test was done, all the T3 T4 was really high. Now doctor is telling that to remove the thyroid gland itself. So what we are treating, actually, the patient was happy. Now we have put on that, they told that the patient is having thyroid, put on drugs. Now we are removing the gland itself. So where are we actually? Now we are forgot one thing, is that there is a nerve to the thyroid. So if you are able to correct the thyroid nerve, the problem is solved. Say why? Because the brain will control the thyroid in the one thing by TSH. Okay, there is one more coding from the brain to the thyroid through the nervous system also. So when this is not working, it will sense it is something danger and it will produce heavy TSH, so that it thinks that T3 and T4 is not really adequate. So that creates a really problem. And body has got one more controlling mechanism, that so anti-thyroid hormone bodies are being released to combat the excess produced TSH hormone. So that is the real pathophysiological process which has been taken place. By just seeing the antibodies, you think that there is a thyroid problem, and if you are able to put simply a thyroxine, then what is the use there? So if you are able to understand the body system of the body, and if you are able to correct few srotas which has been blocked, it will be a job of only a few days. Within few days, the patient will recover, and patient will be divided of all the problems. Patient till now, she thought that decrease of the ability of movements of hand, all those things because of thyroid. When I have corrected the nerve, immediately she gained the power. I have showed shared one video in my Marmakalai and Nadi. One patient had come to me from she is a nurse in UK. So she told that I don't have any power. She was a famous arm wrestler. She has won different championship in arm wrestling. And I told her, after correcting the nerve, you should come to one match next in the next sitting next week. And she came to me, and luckily I just able to win over her. That's it. But that much power she gained it. So it means that there is some lacuna when we are getting within few minutes, we are getting results. What is the problem? If you're we are making the things much more complicated. So henceforth, if you are able to understand the Nadi, our structure, how to correct it, it is an easy job without much medicine. Without much medicine, the problems could be solved. So actually, how the medicine should be? Medicine should be just like a lighter. If you on the gas, only a spark of light is sufficient to ignite the stove. Getting the point? It should not be like big burner. Need not have the big system to fire, because that will destroy our body also. Henceforth, that medicine should be something like a spark, a microdosing. So only I have talked about microdosing. You can see over my YouTube channel, I have posted regarding the microdosing, and I have spoke about Ayurhomeo, how to incorporate into our the practice. Everything I have spoken about. So coming to the point, so next thing, importance of Nadi diagnosis. So Nadi is one of the world's cheapest tool to assess all the disease before it manifests, and it's a prognostic tool. Few days ago, one patient had come to me. So I just felt his Nadi and told these are his problem, and he was not able to, because it was a little bit late in the night. So you come next time. So by just telling, he just started correcting all the what he was doing the wrong things. So immediately when he came next time with few more patients along with him, I felt that now you are feeling much better than before. What you have done? So you are really astonished. All right, doctor, how you are able to understand that now I am feeling better? Yes, that is possible. So it's a diagnosis as well as prognostic tool. So even need not patient tell you that I am acha ho gaya. Few patients will keep on telling, even though they have been getting good result, they tell that no doctor, it's same thing. You also hear it, Are Baba, what is that? What medicine I have to give? What next and all. So what I am telling you is that if you are able to understand the Nadi pulse, you will be able to tell, no, see, last time you did not have, now you have it. I know that. Yes sir, yeah. Now only the patient will agree that yes, whatever you have said is right. So now coming to the point. So here we will understand the past, present and future of a person's health, mental status, by which we'll be able to understand the soul and the past deeds. So till now it was a neglected tool where we Ayurvedic doctors did not give sufficient importance to it, nor it was the curriculum in BMS studies, because there was no proper way of teaching the Nadi, because every reference of Nadi is being very much scattered, as there was a lack of knowledge, as the Nadi Vaidya was maintained in Gaupya Avastha, as it is a dangerous tool if it is acquired by a selfish people, because they can understand your manas and might take advantage of it, and many more. I need not tell you, if we are able to understand a personality and your character by just feeling the manas, it will be a dangerous tool itself. So henceforth, so not many doctors taught this, because only with a proper shishya, that is who is really like trustworthy, whenever the doctor feels that he is perfect student, then only he will teach this vidya to the doctor. So why I am telling you is because, so whenever we are not telling these things, how we people will be able to understand that. So all the Charaka Shushruta Bhagbata era is gone. We had our famous
No sound.
just like, yeah, Asta Mahavaidya, Cherenarana Namudri, many famous physician of Nadi.
Joseph sir, your internet seems to have a problem.
Okay. So bear with me. Okay, fine.
Internet has gone, sir.
Video is gone. Okay, so we are running short of time. So shortly we'll be going in.
Sir, your phone is unmute.
Yeah. Are you able to see me now?
Yeah. Now we can hear you.
Okay. So last coming to the point, we have only left with a few minutes, only 4 minutes. After that, we will be able to go into the discussion section. So you can log into one more ID which have been given in the my WhatsApp channel. Okay. So who can study Nadi diagnosis? So all the person who has the interest and moreover have ambition to help the people around them, need not to be a doctor alone, but also one can anyone without selfishness, those who are able to study, they can study. So only this vidya is kept on air. So only this vidya is kept on air, such that those who learn will become a good doctor, and those who listen will turn their lifestyle and become good human beings with good morals. So studying this is something like reading our own mind and understanding our own mind and others. So way of holding the Nadi. So this is Pancha Jnanendriya Nadi waves. So eyes are related to the light wave, ear sound, nose smell, tongue taste, skin related to the touch wave. So sound is a medium of speech. Animals also communicate by sound. Our heart beats by sound, lub dub. By one tone of the voice, we will be able to understand its scolding. That could be of any language. If you hear a sound, you'll be able to grasp. That could be a Chinese or any language. You'll be able to understand whether they are scolding or they are appreciating. So henceforth, sound gives a certain wavelength, so by which we'll be able to understand what it means. So it is clear that voice produced have wave of love is same in all languages. So when a person is hurt by our words, it creates a vibration in our body, causing depressive feeling, leading to slow basal metabolic rate. If you are angry with anyone for prolonged time, leads to increased in basal metabolic rate. What will happen? The wrong chemical reaction will take place. So henceforth, if you are angry, what will happen? The all the negative hormones or the destructive hormones will release and will destroy you and not the person whom you are angry with. Henceforth, be careful while you are angry with someone, because you are destroying yourself. Getting the point? This is the characteristics of sound. Okay. Sound can be represented as the mixture of their component sinusoidal waves of different frequencies. The bottom wave have the higher frequency than those are having the horizontal. Even we use ultrasound in the medical field for understanding. As you seen, the sinusoidal waves of sound have greater wavelength. Below has in light, we saw each color starting from violet, the wavelength goes on increasing, and we compare each wave to the Saptadhatu. What are the Saptadhatu? Rasarakta, Mamsa, Meda, Asti, Majja, Shukra. In the same way, we understood sound wave have the same wave pattern as that of light, and the result of that were same. Okay, so only as we have here few songs or chanting few mantras, we are getting relaxed. So only when we go to temple, church, mosque, we feel a positive vibration. And in the same way, when we hear a sound of a horror movie, we'll be having a negative vibration of fear. So now you understood that there is a sound making us happy, sad, angry, love, romantic, song, pleasant feeling, etc. The sound of the speed of the sound depends upon the medium. The waves pass through it. So you can see it later. So you can go through the Muladhara chakra. So the mantra, Mula mantram is Lam. So it will initiate or trigger the Muladhara. Swadhisthana is Vam. Manipura is Ram. So Anahata is Yam. Vishuddha chakra is Ham. And Ajna chakra is Om. So now you understood that swara of Sikh chakra and the mantra also. By reciting those mantras, the chakra will get stimulated and recharged, as well as the manas will become in a equilibrium state. And now we have to understand one thing. If a person comes to you by stealing a car for sound therapy, it will not help you. So there should be a repentance before any therapy to work. So you have to remove the past deeds or cleanse your mind. So only new things will enter into your body and mind. So give Sattva Vajaya Chikitsa and create repentance so that he will come back. Getting the point. So one of the patient just came to me. I have got very much jealousy of my mother-in-law. So what to do? I'm having she did not come to me like that. She told that she's suffering from gastritis. I told that some mental element also is there along with that. Then she agreed that I am real jealousy of my mother-in-law. So what the Sattva Vajaya Chikitsa should be there. It should be a like enlightening for her, because only this you are having that. So henceforth, the guiding force, enlightening force should be there. So when we chant Om, it vibrates at the frequency of 432 hertz. The same vibration frequency found in all things throughout the nature. Om is the basic sound of the universe. Chanting it symbolically and physically tunes us into that sound and acknowledge our connection to everything in the world and the universe. Because see, Om has that potentiality. It is three sounds which been exhibited through the mouth without the help of the tongue. So it is a universal sound. In in Hindus they tell Om. So in Christian they tell Amen, and in Muslim they tell Amin. So all these are being derived from one thing. So when you go to Tamil, they have a special that they add for each and everything is N. Shankaran Pillai, Shankaran, Raman, Rama becomes Raman. So in the same way, has it entered the different tradition, it attained different position. That's it. The Mulatha mantra is Om itself. In the same way, color violet, rasa, in the same way you can go through that. Chakra, you can go through that. So if negative waves influence all the chakra, positive wave have influence over the negative wave. So and